time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing that.
What's going on? What's going on? Good evening. Welcome to Steve the Kidney Nurse. Thank you for watching. If you can, share this broadcast. Again, this is not going to be long. This is an important education topic that just need to be discussed, and that's beta blockers, what you need to know. As a charge nurse, when I worked in dialysis, every month we ask kidney warriors to bring in their medication so we can document it in their medication record. And so a lot of kidney warriors, not all, but many, take multiple medications and don't know like the classifications or why they're used. They just take it because the doctor says so. They may have an ailment, say for instance, heart failure. That's a known one, heart failure. That kind of ties in with diabetes and kidney disease. And so when you look at the medication, when patients used to bring their medications in each month, what I started to see was a pattern. And what I mean by a pattern was Mr. Jones, Mrs. Scott, Mrs. Johnson, Mrs. Kennedy, all of them were taking pretty much the same medications, different dosages, but pretty much the same. So tonight, I'm going to talk about one type of medication that a lot of kidney warriors take that's called beta blockers. Okay, now beta blockers are a type of medication used to treat either heart failure or sometimes high blood pressure. Now let's take a look at what this means and what beta blockers can do to keep you healthier, okay? So when we talk about beta blockers, we first have to ask, what is heart failure? Now, it sounds just like the name. Your heart is failing, right? But let's take a look at what is heart failure. Heart failure is when the heart is not able to pump out as much blood as the body needs, okay? Now, this is a problem because your body won't get all the oxygen and nutrients it needs from your blood. If the blood can't pump out the blood it needs to get to your vital organs with the oxygen, it's going to be a bad deal, right? So, as I said, this is a problem because, again, your body won't get all the oxygen and nutrients it needs from the blood. Heart failure can happen in a couple of different ways, right? You may say, how do I get heart failure? How does it happen? Now, in some people, the heart has trouble squeezing blood out. In other people, the heart has trouble relaxing. Now, your heart needs to relax in between heartbeats so that it can be filled with blood. If your heart doesn't relax enough, it won't fill up with as much blood. If it doesn't fill up with as much blood, then it can't pump as much blood out to your body. Now, when this happens, how does your body respond to this? Now, when your heart is not pumping out enough blood, your body or your brain sends out a messenger, which is a hormone that tells the heart, beat faster to make up for this deficiency. Now, unfortunately, this makes your heart work harder, all right? This can actually cause more damage to your heart by working harder and faster and not relaxing and function at its normal heart rate. Now, how do beta blockers, let me see if I got, hold on for a second. You may have seen the medication. Hold up. All right. Hold on, guys. I'm just trying to pull something up so I can show you. And I mean, if you're in medicine, you know how they look like. I don't really need to show you, but they may look something like this. Now, how do beta blockers treat heart failure? How does it? This is where beta blockers can come to the rescue if you have heart failure. Beta blockers get their name because they block the messenger, the hormone, from telling your heart to beat faster. All right, they stop that from happening. Now your heart won't beat faster. Now, since your heart is now beating slower, it has more time to refill with blood. Therefore, more blood can be pumped out to your body. Beta blockers can also help your heart squeeze out blood better. Now, beta blockers can also treat other high blood pressure. Now, how is that, you may ask? When your blood pressure is too high, your blood pushes against the walls of your blood vessels too hard. Now, over time, this can damage your blood vessels. This can limit the amount of blood that can flow through, This can limit the amount of blood that can flow through them to your body. It can also damage your heart and kidneys. Some beta blockers can help relax your blood vessels so that there is more room for blood to flow through. This makes it so that your heart doesn't have to work as hard. Now, which one of your medications is a beta blocker, you may ask? Depending on what conditions you have, Your doctor may prescribe multiple medications that treat heart failure or high blood pressure. Now I'm going to give you a list of medications that are considered beta blockers. And you tell me or give a thumbs up if you take these medications. Atenolol or tenormin, bisoprolol or Zebeda, carvedilol or Corig, labetalol or Trandate, and metoprolol, which is low pressure or toprolol. Now, it can be very dangerous to suddenly stop taking a beta blocker. Just know that. Don't just stop taking your medicine. All right? Talk to your doctor if you have any questions or concerns about your medications. All right? Now, again, I know there's many warriors out there taking multiple medications, blood pressure, beta blockers, and other medicine, calcium channel blockers. Now, again, I want to go over the medicines, and these are beta blockers. Atenolol, or it may be called tenormin. Bisoprolol, or it may be called Zebeda. Carvedilol, or it may be called Corig. Labetalol, or it may be called Trandate. And metoprolol, which may be called low pressure or toprolol. I got one comment. Hey, Jared, what's going on? All right, if you're still on and still watching, why don't you hop in the back room? I'm about to end in a minute, or we can do it in maybe 30 minutes. So I'm going to get a bite to eat. But yeah, guys, beta blockers. If you're taking any of those medications, that's what it's used for. Either heart failure or high blood pressure. And I went over beta blockers, how they treat high blood pressures. I went over what heart failure is, and I went over how does your body respond. So if you got any questions, please feel free to reach out to Steve, the kidney nurse, through my email or through my messenger on my Facebook page, and I'll be happy to answer it. Thank you guys for tuning in for this short 14-minute education session on beta blockers, what you need to know. God bless you and have a great, great holiday. This will be the last, I don't know if this is going to be the last broadcast. I might do something tomorrow, but if I don't do anything tomorrow, I wish everyone watching happy holiday, happy Hanukkah, Merry Christmas, whatever, or however you celebrate this holiday season. Have a happy holiday from Urban Kidney Alliance, Urban Health Outreach Media, and Steve the Kidney Nurse. Thank you guys, and God bless you. Peace.